All right, everybody, my name is Aaron Smith. I'm here with my sister Skyla today, and we're ready to do our head-to-toe assessment. Any good head-to-toe assessment, you always want to start with vital signs. I am going to take a quick blood pressure real quick on Skyla here. Okay. All right, and I got a nice blood pressure of 122/68. For the sake of this video, we'll just stick with the blood pressure today. You also want to get the heart rate. You want to get respirations for a full minute. You want to get an oxygen saturation and a temperature as well. All right, so we're going to start with the skin assessment today. I want to start by looking at Skyla's hair. I want to note that it looks clean, it looks shiny, showing that it's hydrated. The hair is evenly distributed. I don't see any alopecia, any infestations noted. Just want to look at her skin as I go down. The hair is also evenly distributed on her arms, on both arms. The hair is evenly distributed on her legs. All the way down I see a little bit of hair on her toes here. It shows good blood circulation, good blood flow to the extremities. Her skin is also pink. It's warm. It's dry. We can check for any tenting. She has good elasticity, showing that she's well hydrated. On the elderly, you can also check for hydration on the sternum. Their hands tend to be less elastic as you get older. I don't see any lesions on Skyla, no abnormalities in the skin assessment. Okay, so we're going to start with the head and neck assessment now. When I'm looking at Skyla's head, I want to note that it's upright. There's no jerking, no tremors noted. I want to note her palpable fissures. They are symmetrical bilaterally. I also want to note her nasolabial folds, and they are also present and symmetrical bilaterally. Moving down her head to her neck, I want to note that her sternocleidomastoid muscles, they are also symmetrical bilaterally. While I'm working on her head, I also want to palpate the carotid and temporal pulses. For the sake of the video, I'll just do one side, but you always want to compare bilaterally. Temporal is a +2 pulse, and her carotid is also a +2 pulse. I'm going to take my stethoscope here, and I'm going to use the bell of my stethoscope, and I just want to auscultate her temporal and carotid pulses again, listen for any bruits, any turbulent blood flow. And Skyla, I'm just going to ask you to hold your breath while I listen to your carotid artery. And I don't hear any abnormal blood flow. And again, you would compare this bilaterally. Okay, so we've established that Skyla's head is normocephalic. I also do want to note that her trachea is midline. We're going to assess her thyroid now, and I'm going to take my light here and bring it out a bit. I want to just shine this light right on her throat. Now, Skyla, I'm going to have you tilt your head back a little bit and go ahead and swallow for me. Okay, and I can note that her thyroid moves appropriately during swallowing. Now, Skyla, if I could have you sit on the edge of the table and face that direction there. I'm going to palpate your thyroid from behind here. Skylar, is there any tenderness while I'm palpating your thyroid?
No.
Okay, I'm going to have you tilt your head to the left. And you have the patient tilt their head so you can kind of move the thyroid, shift it so you can get a better feel. Any tenderness there?
No.
And to the right as well? Okay, no tenderness there.
No.
All right, the thyroid is firm. I don't feel any nodules. There is no tenderness. So the thyroid appears to be in good repair. Okay, so I want to assess Skyla's temporomandibular joint now. I'm going to place my 2 fingers on each side of the joint. Skyla, can you open and close your mouth for me? Perfect. Can you move it side to side? Okay, a little bit of clicking, a little bit of popping noted. And can you protrude and retract it for me? Stick it out and then right back. That's perfect. Is there any tenderness when we did that?
No.
Okay, so there's full range of motion of our temporomandibular joint. There is slight clicking and popping when it moves laterally, but other than that, full range of motion seems to be good. All right, so we're going to assess Skyla's lymph nodes now. You want to use the pads of your 2 fingers. They're a very sensitive area. You can feel the lymph nodes a little bit better. So we're going to start with the preauricular nodes. That's in the same spot as the temporomandibular joint, kind of right in here. I want to note that those are non-palpable. You want to move behind the ear to the posterior auricular nodes. And I don't feel anything there. Those are also non-palpable. I want to feel the tonsillar nodes just underneath the jawline. Oftentimes those ones can be palpable when you have an infection brewing or something to that effect. I do not feel anything today. I also want to feel the submandibular nodes, and those are non-palpable. And I want to feel the submental, and those are also non-palpable. All right, so now we want to assess the anterior superficial cervical lymph nodes. They are right along the sternocleidomastoid muscles. So I just want to palpate in here, and you let me know if there's any tenderness. That feels okay? Mm-hmm. All right, you want to move a little bit further back. I'm going to move to this side so the camera can see here. You want to palpate a little bit deeper for the deep cervical chain, still along the sternocleidomastoid muscle. And just in front of the tragus muscle here, you feel for the posterior cervical chain, and nothing is palpable there. And you want to feel for the supraclavicular lymph nodes, and that is above the clavicle. And also the infraclavicular lymph nodes, which are underneath the clavicle, which are a little bit more difficult to feel. Okay, so we want to assess the lymph nodes in Skyla's axillary area. Skyla, if you could just raise your arm slightly for me. We want to take a look at her central nodes, and we're just going to look right up underneath the axilla. I want to assess her lateral lymph nodes following the humerus in the back of her arm. I also want to feel for her pectoral nodes just behind the pectoralis major. And here in her back, I want to feel for the subscapular lymph nodes. Down here, following the radius, you want to feel for the epitrochlear lymph nodes as well. Those are all non-palpable. No tenderness noted, Skyla? All right, no tenderness noted. Okay, so in closing off the section regarding lymph nodes, you just want to note that if the lymph node is soft and round and palpable, that's okay. It just sometimes indicates a sign of a basic infection. Often you can feel the tonsillar lymph nodes when somebody is coming down with an illness. If it is hard and fixed, sometimes that can indicate a further issue that you want to tell the patient to go get assessed. The last 2 lymph nodes that you would look for is the horizontal chain, which runs in the groin along your femoral artery. And if you go in a downward motion, that is your vertical chain. All right, so we're going to start with our ears, eyes, nose, mouth, and throat assessment. So we've already checked Skyla's distant vision using the Snellen chart. We've checked her near vision by doing the newspaper test, holding a newspaper 14 inches from the nose, and Skyla had no issues with distant or near vision. I'm going to start with the eyes. I want to look at the external portion of the eyes. I want to note that her eyebrow extends from the inner canthus of the eye to the outer canthus of the eye. Can you wiggle your eyebrows for me? They are full. No issue with eyebrow movements. Okay, I want to note the lacrimal apparatus. I don't see any drainage. Lacrimal apparatus is equal bilaterally. I'm going to check for regurgitation too by pushing on the lacrimal duct. And I don't get any regurgitation of fluid, which is a good thing. I also want to note that her sclera is nice and white, and her eyelashes, both upper and lower lids, they do curl outward, which you want to note as well. Okay, so we're going to continue to assess Skyla's eyes. First thing I want to do is I'm going to take my light here and I'm going to shine it in Skyla's eyes, both eyes, and I just want to note that she doesn't have any abrasions, any lacerations to her sclera. As I shine the light in her right eye here, I want to note that both pupils are constricting, and this tells me that she has a consensual response, which is a normal finding. I also want to shine the light directly in her eyes here, and I do note that the light is shining symmetrically in both eyes. And as I look at Skyla's eyes, I note that her pupils are round, her irises are consistent in color. Skyla, if I could have you look at the wall in front of you, and as I see Skyla look at a distant object, I observe that her pupils are dilating, they're getting bigger. And Skyla, if I could have you follow my finger closer, and as my finger gets closer to Skyla's face, her pupils constrict at a near object, which is also a normal finding. Okay, so typically I would be checking Skyla's corneal reflex. The way I would be doing that is by touching her cornea with this cotton-tipped applicator. The test is a little bit invasive, so I'm not going to poke her in the eye right now. But the reason you do this test is to check for a bilateral blink response. Okay, the next thing I want to do is check Skyla's extraocular muscular movements. So Skyla, what I'm going to have you do is I'm going to make a big H and you're going to follow my finger, okay? And down, back up, cross, up. Okay, and I note parallel tracking of the eyes, which is a normal finding. Extraocular movements seem to be intact. I also want to check Skyla's peripheral vision. So what I'm going to have you do is cover one eye. Okay, and you look right at me and tell me when you see my finger, okay? Okay, good. Peripheral vision is fine. Skyla's extraocular movement seems to be intact. All right, so we're going to continue with our ear assessment. I want to note that Skyla's ears are symmetrical bilaterally, which they are. The top of the auricle should, if you drew a straight line on the side of her face, should match up with the outer canthus of her eye, which they do. I do want to assess her ear for tenderness. I'm going to pull back on the top of the auricle. Any tenderness there, Skyla?
No.
I'm going to push on the back of the mastoid process. Any tenderness there?
No.
Okay, perfect. You do want to note that the ear is about 4 to 10 centimeters in length, which it is, so that is good. I do want to assess the inside of Skyla's ear with my otoscope. And Skyla, you let me know if there's any tenderness while I'm doing this. Okay, what I'm seeing is her ear canal is pink. There is a small amount of cerumen inside her ear, which is perfectly normal. I do note fine villous hair is present. I could see her tympanic membrane, which is pearly gray, and the bony prominence was visible as well. Okay, so next we're going to do what's called a whisper test to test Skyla's hearing a little bit more. What I'm going to do, Skyla, is have you cover your left ear. Okay, and I'm going to whisper 3 words, and you're going to tell me what I said. Fork, knife, spoon.
Fork, knife, spoon.
Fork, knife, spoon. Okay, so she heard 100% of the words, which is excellent. The next thing I am going to do is do what's called the Weber test. Okay, this test to see if Skyla can hear equally in both ears. Skyla, I'm going to place this on top of your head. And can you tell me if you hear this equally in both ears?
I do.
Okay. So it shows that she has equal hearing bilaterally. There is no lateralization to either side. Next, I'm going to do what's called the Renee test. So I'm going to do the same thing. I'm going to hold this behind your ear, and you tell me, excuse me, I'm going to go over here. You tell me when you stop hearing the noise, okay?
No.
Okay.
No.
Perfect. Okay, so her bone conduction was about 8 seconds, and her ear conduction was approximately 16 to 17 seconds. So her ear conduction was about 10 seconds greater than bone conduction. Okay, we're going to move on and assess Skyla's nose now. I want to note that her nose is midline. I'm going to palpate it. Skyla, any tenderness during palpation?
No.
All right, perfect. Her skin is warm. It's pink. It's dry. Same color as the rest of her face, which is excellent. I don't see any drainage, no nasal flaring, no signs of respiratory distress. Skyla, I'm going to look up your nose now with the light. And I do see fine villous hair. I see that her mucosa is pink and moist. Again, no nasal drainage. Skyla, I'm just going to have you occlude one nostril. Breathe. And do the same on the other side. Okay, excellent. Nostrils are patent, no issues with breathing. The last thing I want to do is palpate your frontal sinuses. No tenderness there, correct?
No.
Okay, I'm going to palpate your maxillary sinuses. No tenderness there.
No.
All right, excellent. Okay, so the last thing I want to do when assessing Skyla's nose and her sinuses is I'm going to trans-illuminate her sinuses. For this test, the room should be fairly dark to get good results. So what I'm going to do is I'm going to shine my light. We'll start with the frontal sinuses. And you should get a nice red glow on each sinus. This shows that the cavity is air-filled as it should be. I'm going to check the maxillary sinuses as well. And I'm not sure if we can see this with the camera, but I am getting a nice red glow, which means her sinuses are nice and air-filled. Okay, to end our ears, eyes, nose, mouth, and throat assessment, we do have to assess Skyla's mouth. I want to start by assessing her lips. I see that they are perfectly symmetrical. They are pink and moist. I don't see any cracking. They seem to be in good health. Skyla, if you can bite down for me and show me your teeth. Okay, her teeth, her bite, slight overbite, but her bite's okay. Her teeth seem to be in good repair. Can you just show me your teeth real quick? Her teeth are in good repair. They are white in color. There's no dental caries that I see. I also want to note the color of her gums. Her gums are pink. They are also moist. I don't see, I do notice that they are well adhered to her teeth. All right, so I'm going to assess the inside of Skyla's mouth now. Skyla, if you could open your mouth for me. I just want to assess the roof of her mouth, the hard palate. I note that it does have some transverse rugae. I want to look underneath your tongue, if you could put the tongue to your roof of your mouth. The soft palate is pink and moist. I do note that the uvula is midline. The tongue is midline. Open your mouth one more time for me. And make your tongue flat if you could. Perfect. And I can see the tonsils at the back of her throat as well. The last thing I want to do is use this cotton ball. I'm just going to move your tongue around. I'm going to check for any lesions. Okay, the tongue moves freely. I don't see any lesions. The tongue is pink and moist, and the mouth seems to be in good repair. Alright, so we're going to start with our respiratory assessment. The first thing I want to notice is that Skyla has nice upright posture. Her skin is nice and warm and dry to touch. I'm going to assess her conjunctiva in her eyes. I see that they are nice and pink. I don't see any signs and symptoms of respiratory distress or shortness of breath, no nasal flaring. I don't see any intercostal retractions. She seems to be comfortable and at rest. Another thing I would do is I would assess her pulse. You want to count that for a full minute, and it should be within normal limits. Another thing I want to have you do, Skyla, if you could put your two thumbs together for me. I do want to note that hold them right up like that for me. Perfect. I just want to note that her nail angle is 160 degrees, which is what we want to see. Alright, so the next thing we're going to do is we're going to assess Skyla's lungs from the back. First thing I'm going to do is just assess, I'm going to feel her back for any tenderness, any possible tumors or lumps, also for any crepitus as I press down. Skyla, let me know if there's any tender areas as I feel across your back. No tenderness anywhere?
No.
Okay. Perfect. Next thing I'm going to do is I am going to check her thoracic expansion. I'm going to put my thumbs on right around the 10th thoracic vertebrae. Skyla, if you could take a deep breath for me. Okay, and I do note equal thoracic expansion upon her inhalation and exhalation. Another thing I want to do is test for tactile fremitus. So Skyla, when I put my hands on you, we're going to do about 7 different areas. I want you to say 99 for me, okay?
Okay. 99, 99, 99, 99, 99, 99.
All right, great. I do feel the fremitus decrease as I move from the apices of the lungs to the basis of the lungs, which is a normal finding. Okay, now we're going to do a test called diaphragmatic excursion. Basically to test the amount of air that you can take in and let out, your maximum inhalation and exhalation. So Skyla, what I'm going to have you do is well, first let me get 2 pieces of tape here. I'm going to have you breathe in fully and exhale fully, and I want you to hold that exhale until I tell you can breathe, okay?
Okay.
Hold on 1 second here. Okay, so go ahead and inhale fully and exhale fully all the way. Breathe out. And hold that exhale. Okay, so I'm going to percuss until I feel dullness. I hear dullness. I'm just going to mark that area with a piece of tape. And Skyla, I'm going to have you breathe out all the way. Get in a couple of breaths. Okay, and then you're going to inhale fully, and you're going to hold that inhale for me. All right, and there's that dullness again. I'm going to mark that with a piece of tape. You can go ahead and breathe. Okay, and then I'm just going to measure the area in between both pieces of tape. And that area should be about 4 centimeters. I'm getting here about 3.5 centimeters, which is what we want to see. All right, so now it's time to auscultate Skyla's lungs. So what I'm going to do is I'm going to place the diaphragm of my stethoscope on several areas. Skyla, when my stethoscope is on you, I'm just going to have you take nice full deep breaths, okay?
Okay.
Full deep breath. And another. And another. And another. Okay, now I'm going to place my stethoscope on several more areas, but don't take a deep breath. I'm just going to show everybody where to place your stethoscope properly.
Okay.
So you want to place it here, and here, 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 and here, and here, and here. And that completes the auscultation of the lungs. Alright, so we're going to start the cardiovascular assessment now. First thing I want to do is just start by inspecting the chest wall. I want to observe for any pulsations or heaving of the heart, see if the heart is raised or possibly enlarged. Everything looks okay. I then want to palpate each of the 5 different points of maximum impulse on Skyla's chest. So at the second intercostal space on the right side of her sternum is the aortic area. If you move to the left side of her sternum in the second intercostal space, you have the pulmonic area. The third intercostal space on the left side of the sternal border is going to be your Erb's point. And if you move down to the fourth intercostal space, you will feel the tricuspid valve. And the fifth intercostal space, mid-clavicular line, is the apical pulse. And I do not feel any murmurs, any turbulent blood flow upon palpation. Next thing I want to do is auscultate the 5 areas of the heart and listen for any high-pitched noises. When listening for high-pitched noises, you want to use the diaphragm of your stethoscope. So I'm going to start with the aortic area, second intercostal space. I'll move to the pulmonic. And the Erb's point. Tricuspid, and the apical pulse. So when listening to Skyla's heart sounds, I did notice that the S2 heart sounds were definitely more prominent in the aortic and pulmonic areas. At Erb's point, S1 and S2 were pretty equal, and in the tricuspid and apical areas, S1 was definitely the more prominent heart sound. So what I'm going to do next is I would like to listen to those areas again, except I'm going to use the bell of my stethoscope this time, and the bell helps lower pitched noises come out. S3 and S4 sounds can be heard better with the bell of the stethoscope, as well as murmurs. To aortic, pulmonic, Erb's point, tricuspid, and apical. And I do not hear any S3 or S4 heart sounds, and no signs of murmurs. So several other techniques to bring out S3 and S4 heart sounds as well as murmurs is to have the patient lay on the right side. Just kind of helps to shift the heart so you can hear it a little bit better. The second technique you can use is to have the patient sit upright, such as this. Skyla, I'm going to have you lean forward a little bit. Helps bring the heart to the chest wall. You want to listen to those 5 areas again, once with the diaphragm, once with the bell, to listen for both high-pitched and low-pitched noises. So we'll do it one more time with the diaphragm. Aortic area, pulmonic area, Erb's point, tricuspid, and apical pulse. Okay, and the last thing I want to do for the cardiac assessment is assess all of Skyla's pulses. So we'll start with the temporal pulses. I'll do them on one side, but again, you always want to do all of your tests bilaterally. So she has a 2 plus temporal pulse. To assess the carotid, 2 plus carotid pulses. I see your arm there. Assess her brachial pulses. A nice strong brachial. It's also 2 plus. You want to assess the ulnar pulse. 2 plus ulnar pulse. You want to assess her radial pulse. And that's great. Nice 2 plus radial pulse. Moving down to her legs. I'm not going to roll up her jeans. They're a little bit tough to get up. But you want to feel for her popliteal pulse behind her knee. Well, it's always a little bit difficult to feel, but she does have a 2 plus popliteal pulse. I want to feel her pedal pulse. It's 2 plus pedal pulse. And the last one you want to feel is the posterior tibial pulse, which remember is on the inside of the foot, just underneath the Achilles tendon. And that is a 2 plus posterior tibial pulse. Alright, so time to begin the abdominal portion of the assessment. As you can see, the patient is laying in a supine position. Knees are slightly flexed, hands are at her side, and her head is slightly tilted back at a nice 35-degree angle. This really helps loosens up the abdominal area, making it easy to assess. First thing you want to do is just inspect the patient. You want to note any pulsations. And she is actually nice and thin, so you can see a nice aortic pulsation. Oftentimes you can see that when somebody is super thin. You don't want to see any peristalsis happening. That's usually not a good sign. You want to note any scars from maybe past surgeries. If the patients are having any tenderness in the scar, could be a sign that there's an adhesion underneath the scar that needs to be taken care of. Alright, so let's begin the abdominal portion of the assessment. As you can see, we have the patient laying supine. Her knees are slightly flexed, her hands and arms are at her side, and her head is in a nice 35-degree angled position. This really helps to loosen up her abdominal muscles, making the assessment easy on us. Okay, so you just want to inspect the abdomen first. Note any pulsations that you see. Actually, with her, she's fairly thin, so you can see an aortic pulsation, which is normal to find in a thin individual. You don't want to see any peristalsis happening. You want to look for any scarring. See if the scars are tender. Sometimes if the scars are tender from past surgeries, it could mean that there's an adhesion happening underneath the scar, which could be a further issue that you'd want to take care of. You do want to assess the umbilicus as well. Check for any umbilical hernia, any tenderness there in that area. Before going any further with the assessment, you also want to have the patient empty their bladder before the assessment for their comfort. Okay. All right, so now we want to auscultate the 4 quadrants of the abdomen. You want to use the diaphragm of your stethoscope for this. Okay, and bowel sounds are normal, active in all 4 quadrants. You do want to listen to each quadrant for up to 1 full minute to listen for bowel sounds. You want to flip your stethoscope over to the bell side and auscultate the abdominal aorta for any sign of a bruit or turbulent blood flow. I don't hear any bruit there. Just to the right of the aorta, you would check for renal stenosis on the renal artery, also at the bell of your stethoscope. And I don't hear any bruits there. And then I'd move down to the iliac crest area and just place the bell of my stethoscope there. And I don't hear any turbulent blood flow there either. Okay, also when auscultating the different arteries, you'd want to auscultate the femoral artery as well in the groin area. Also check for any bruits with the bell of the stethoscope. I'm going to start with just a gentle palpation to see if there's any tenderness as evidenced by facial grimacing or guarding with her hands. Skylar, is there any tenderness when I press on your abdomen anywhere?
No.
No. Okay, so no facial grimacing, no guarding noted. I'm going to go a little bit deeper with a deeper palpation to feel for any masses, also any tenderness. Any tenderness when I palpate a little bit deeper?
No.
No. Okay. All right, so I just want to finish up my palpation. I want to palpate the liver on the right side. Can you take a deep breath for me, Skylar? Okay, now I'm not really feeling the liver. It's non-palpable. Occasionally you'll feel the outer edge of the liver. You shouldn't feel any more than that. You definitely don't want to feel any nodules. Could be a sign of liver enlargement if you feel any more than that. You also want to feel off to the left side, feel for the spleen. And the spleen is non-palpable as well. Alright, so we want to continue by percussing the abdomen. Okay, and the abdomen's pretty tympanic throughout. Occasionally you'll get a little bit of dullness in the lower abdomen if the patient has any stool present, but for the most part it's pretty tympanic. I do want to percuss the liver as well. Scott, I'm going to have you kind of tilt a little bit on your left side. If you can just lay towards me a little bit. Reach your arm across. Perfect. Okay. So I'm going to start kind of mid-clavicular, and I'm going to percuss for the liver to measure the size. All right, right there. I'm going to place a piece of tape. Okay, and I'm going to feel for her umbilicus. Go right over her. Okay, I'm going to place it right there. Well, this area in here should be about 7 to 10 centimeters in length. And it's just about 7 centimeters, so her liver is within normal ranges. Okay, I also want to percuss for Skyla's spleen in the same way that I would her liver. It's going to be along her mid-axillary line between the 6th and 10th intercostal space. I'm not going to do the same procedure for the sake of the video, but just know that it should be between the 6th and 10th intercostal space right in this area here. Alright, so we're going to go over the male genital exam just briefly. I'm going to talk through it. You want to check the penis and the scrotum for any masses, any lesions, any tenderness upon palpation. You also want to feel each individual testes, see if there's any thickening, any tenderness in the testes. Definitely you want to educate on a testicular self-exam that your patient can do at home on a more regular basis. Okay, we'll move on to the breast exam now, and I'm just going to talk through that as well. You want to inspect the whole breast, also both nipples and the areolas. Make sure there's no cracking, no drainage, no tenderness. You also want to palpate. You want to use kind of a systemic approach. Have the patient raise their arm over their head. You may use a pillow for positioning if necessary. You want to start at the area of the axilla. Use kind of small circular motions. Start on the outside underneath the axilla and work your way inward. Definitely palpate the areolas and the nipple areas as well. Again, for any tenderness, you're feeling for any lumps, any firm areas. And also, again, you want to educate on self-breast exams at home as well. All right, so we're going to move on to the musculoskeletal system. The first thing I want to do is assess Skyla's temporomandibular joint. I'm going to assess for range of motion, any popping and clicking that may occur. So I'm just going to feel right here. If you can move your jaw side to side for me. All right, a little bit of popping and clicking there. Open your mouth and close your mouth and protrude your chin and retract. All right, just a little bit of popping and clicking laterally. She does have full range of motion. Next, I'm going to move on to your cervical area. I'm going to feel the back of your neck here. Any tenderness when I push on the back of your neck?
No.
No tenderness. Okay, let's test your range of motion. I'm going to have you tuck your chin to your chest. Perfect. I'm going to have you look at the wall that way and the other way. Okay, why don't you go ahead and touch your ear to both shoulders. Okay, why don't you go ahead and hyperextend your neck. Look up at the ceiling. All right, so we can note that she does have full range of motion in her neck. No tenderness? No. Okay. All right, let's test for your strength next. So go ahead and push against my hand for me. Good. Push against my hand. Good. Push back. Good. And push this way. Perfect. All right, so she does have +5 strength in her neck, full range of motion, and her neck is good. All right, so now we're going to move into assessing the patient's spine. I do want to note that her cervical area is concave, her thoracic area is convex, and her lumbar area goes back to being concave. Skyla, if I could have you bend at the waist and touch your toes, I'm going to assess her spine. First, I'm just going to palpate it lightly. Is there any tenderness when I palpate your spine?
No.
Okay, I am going to feel down her spine, check for alignment. I do note that it is very straight. Why don't you go ahead and stand up for me? And as I see Skyla stand here, I see that her shoulders are equal bilaterally, and they are perfectly symmetrical. All right, so as I was saying before, you want to make sure the shoulders are symmetrical bilaterally. I'm going to palpate the shoulders. No tenderness in your shoulders at all?
No.
No tenderness. Okay, can I have you push up with your shoulders on my hands? All right, very good, and you can relax. She does have +5 strength in your shoulders. I do want to note also that your hips are symmetrical, symmetrical bilaterally. Why don't we test some range of motion? I'm going to have you hyperextend your back, lean back, perfect. I want you to check laterally, lean side to side. Okay, and why don't you rotate? Okay, so she has full range of motion there as well. All right, one other thing I wanted to cover, we're going to do range of motion in the shoulders. I'm going to have you perform flexion by sticking your arms straight out. Okay, good. Right down by your side is extension, and then if you reach your arm back, that's going to be hyperextension, if you could perform that for me. All right, great. Also, what we want to do is put your arm out. That's called abduction, and if you want to put your arm across your body, okay, that is called adduction. All right, now let's put our arm behind our back like this. That's called internal rotation of the shoulder. And if you put it over your head like this, that is called external rotation of the shoulder. So we can say that she has full range of motion in her shoulders. Okay, so next we're going to assess Skyla's elbows. I'm palpating the elbow right now. I don't feel, they're not tender at all, are they, Skyla?
No.
Okay, I don't feel any swelling, any bogginess noted. We're going to test range of motion. I'm going to have you bring it up just like you're lifting a weight. It's flexion and extension. We obviously cannot hyperextend our elbows. Let's test your muscle strength. I'm just going to have you put your arms out like this. And also note that this is supination and this is pronation. Can you flip your hands for me? Pronation, perfect. So she does have full range of motion of the elbows. Now to test strength, I want you to push down on my hands. Okay, and flip your hands back over for me and push up on my hands. Okay, so I do want to note +5 strength in the elbows. We will now check Skyla's range of motion in her wrists. Skyla, I'm going to have you hold your wrist out like this. We are going to flex your wrists. That is flexion, extension, hyperextension. Okay? I'm going to have you bend your wrist inward, such as that. Perfect. That is radial deviation, and outward. That's ulnar deviation. And she does have full range of motion in both wrists. What I want to do next, I do want to note that her wrists are not swollen. They are not boggy. I don't see any deformities. There is no tenderness upon palpation. I'm going to have you make a fist for me. Why don't you flip them around this way? Okay, and I just want to have you curl your wrist up against my hands. Perfect. Can you curl your wrist down too? All right, and she does have +5 strength in her wrists. All right, let's check the range of motion of your fingers. I'm going to start by feeling each individual joint on your fingers. Again, feeling for any bogginess, any swelling. No sign of deformities. There's no tenderness when I touch the joints in your fingers. Okay, if you could squeeze your fingers like this for me. This is flexion of the fingers. Out like this is extension of the fingers. All right, very good. I also want to have you flex your thumb inward across the palms. Okay, that's flexion of your thumbs. So she does have full range of motion of her fingers. One other thing I want you to do is why don't you spread your fingers like this. That's abduction of the fingers, and back in like this is adduction of your fingers. Again, she does have full range of motion of her fingers. Now, if you could squeeze my 2 fingers, make a fist. Don't let go. Perfect. Make an OK sign. Don't let me break it. All right. So she does have +5 strength of her fingers and +5 strength of her thumb. All right. So let's move on to full range of motion of the hip. I'm going to start by just assessing your hip and making sure that there's no tenderness upon palpation. Is there any tenderness, Skyla?
No.
No tenderness. Okay. So we're going to start by flexing the hip. Bring your knee to your chest for me, or as far as you can go. All right. She has nice full range of motion with flexion. We do want to abduct and adduct. And this is also testing external rotation and internal rotation of the hip. So we can note that she does have full range of motion of the hip. If you can keep your knee flexed for me on the table, go ahead and push against my hand outward. All right, and push against my hand inward. All right, great. So she does have +5 strength in her hip as well. All right, so we're going to assess the knee next. Again, I just want to palpate both knees. Any tenderness in the knees?
No.
No tenderness. Okay, I'm going to have you flex your knee, or I should say extend your knee and flex your knee. Perfect. So she does have full range of motion. I'm going to have you go ahead and push back on my hand. Good. And push out. All right, she has nice, strong 5+ strength in her knees. You're going to move down to the ankles. Same thing, you want to palpate the ankle thoroughly, definitely behind the Achilles tendon as well. Okay, and I'm going to have you dorsiflex your foot. Okay, and plantar flex, point it straight down. Very good. I'm going to have you push against. Good. And push up. All right, so she does have +5 strength in her ankles and full range of motion. I should test inversion, so I'm going to have you point your ankles inward. In eversion, try to point your ankles outward for me. So she does have great range of motion in her ankles. And you just want to assess the toe joints as well, any bogginess, any swelling, any deformities, which I don't see any of. If you can just wiggle your toes for me, curl them for me. All right, her toes seem to be in good repair as well. All right, one last thing I want to check before we end our musculoskeletal assessment. We do want to test for carpal tunnel syndrome, and there's 2 ways that we can do that. We can start by doing the Fallon sign. I'm going to have you put your hands back to back like this. Typically, we would hold that for 60 seconds. People with carpal tunnel syndrome are going to have numbness and tingling throughout their hands if they hold this for 60 seconds. If in this case you do not have numbness and tingling, then it would be a negative sign. Next one we're going to do is the Tinel sign. Skylar, I'm just going to have you stick your arm out like this. And all you do is tap the medial nerve. Is there any numbness or tingling while I do that?
No.
Okay. So that would be a negative Tinel sign. So Skylar does not have carpal tunnel syndrome. Okay, so to end our head to toe assessment for the day, we want to finish up by doing Skylar's neuro assessment. First thing I want to notice is that the patient is sitting upright. Her eyes are open. She appears to be alert and orient. We can also use what's called a mini mental status exam to assess if the patient is alert and orient, but we won't do that today. All right, so we're going to test the 12 cranial nerves. The first nerve that I want to test is the olfactory nerve, which is your sense of smell. So Skylar, I'm going to have you occlude one of your nostrils, and I'm going to have you smell this, and with your eyes closed, why don't you go ahead and tell me what this smells like?
Vanilla.
Vanilla. Okay, very good. So she identified the smell correctly, so we can say that her olfactory nerve, cranial nerve number 1, is intact. Now to assess cranial nerve number 2, the optic nerve, we need to check Skylar's visual acuity. We would check in the right eye, left eye, and both eyes. We would check her distant vision by having her look at a Snellen chart, which we did earlier on in the exam. We would also check her near vision by having her read a small newspaper print 14 inches from her nose. Scott, I'm going to have you hold this 14 inches from your nose, about right here. I just want you to read me what that says.
The cat in the hat.
The cat in the hat. Okay, so she read all words correctly. Also, I want to check your peripheral vision. So I want you to cover one eye for me, and we're going to repeat this test. Tell me when you see my fingers.
No.
Fingers?
No. No. No.
All right, perfect. And we are going to check your peripheral tracking as well. So follow my finger for me. Okay, I note parallel tracking of the eyes. Her extraocular movement seemed to be intact. So cranial nerve 2, the optic nerve, is working just fine. All right, so I'm going to take my light source here for a moment. We're going to check Skylar's pupils. I want to look right inside. I want to note that her pupils constrict both directly and consensually as well. I can see that her pupils do constrict equally. Skylar, I'm going to have you look at the wall in front of you. And I know as she's looking at a distant object that her pupils do dilate, they get bigger. And why don't you go ahead and follow my finger. And as my finger gets closer to her nose, her pupils constrict and they also contract. They get smaller. That tests for accommodation. And her pupils are round. So we can say her pupils are equal and reactive to light and accommodation. Okay, now we'll assess cranial nerve number 5, which is your trigeminal nerve. I'm going to start by holding Skyla's temporal area. Why don't you go ahead and close your eyes nice and tight for me? Perfect. Now I'm going to hold the area of her masseter muscle, and why don't you go ahead and clench your teeth for me? Perfect. So I can note +5 strength in both her temporal and masseter areas. Another thing I want to do is test her sharp and dull sensation on those two areas. If you could close your eyes for me. Okay, now I'm going to lightly touch you with, this is sharp and this is dull. Okay, do you understand the difference between the two?
No.
That's sharp.
Okay.
Okay. That's dull.
Okay.
Okay. You always want to make sure that the person being examined understands what is sharp, what is dull to get accurate results of the test. Okay, so I'm just going to, that's sharp or dull?
Sharp.
Sharp? Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Perfect. Okay, so she got 100% of the answers right. Her trigeminal nerve seems to be intact. All right, so we're going to test for cranial nerve number 7 now. What I want you to do, Skyla, is I want you close your eyes really tight for me. All right, open, move your eyebrows. Very good. Close your eyes tight again. Now don't let me open them, okay? Tight, tight, tight. Perfect. All right, why don't you go ahead and give me a smile. Very nice. Her smile is very symmetrical. Her facial nerve, cranial nerve number 7, appears to be intact. Now we will test cranial nerve number 8. So cranial nerve number 8 is your acoustic nerve. And we're going to repeat the test that we did at the beginning of this assessment. Skyla, I'm going to have you cover your right ear for me. I'm going to whisper 3 words. Cat, mouse, dog.
Cat, mouse, dog.
Okay, so she heard 100% of the words. So that's what we want to see. We're also going to do the Weber test for lateral hearing. Skyla, I'm going to place this on the top of your head. Do you hear that equally in both ears?
Yes.
Perfect. So she has no lateralization. Her hearing is equal in both ears. We're also going to perform the Rene test. Tell me when you stop hearing this, Skyla.
No. No.
Okay, great. So her bone conduction was about 9 to 10 seconds, and her ear conduction remains at about 18 seconds. So your ear conduction is almost double that of your bone conduction, which is perfectly normal. All right, so we're going to test cranial nerves 9 and 10 now. I'm going to have you open your mouth for me, Skyla, and say ah.
Ah.
Okay, stick up your tongue for me. Can you put it to the roof of your mouth? Open your mouth. Okay, so when she said ah, it was a little bit difficult to see, but typically what you want to see is a symmetrical rise of the soft palate. Also, cranial nerve number 11 is the spinal accessory nerve. So I'm going to have you do is push up on my hands with your shoulder. Good, and push against my hand. Okay, so +5 strength in her shoulders and her neck area. So cranial nerves 9, 10, and 11, the spinal accessory nerve, are all intact. All right, so we're going to check for the cranial nerves 9 and 10. And what I'm going to have you do, Skyla, is open your mouth and say ah.
Ah.
All right, good. I did see symmetrical rise of the soft palate. Also at this time, we typically take a tongue depressor and elicit the gag reflex to make sure that the gag reflex is present. Cranial nerves 9 and 10 appear to be intact. We also check for cranial nerve number 11, the spinal accessory nerve. What I'm going to have you do is push up on my hands for me. Perfect. And I'm going to have you push against my hand for me. And good. +5 strength in the shoulders, and when she pushed against my hand, so spinal nerve 11 is intact. So the last cranial nerve that we want to assess today is the hypoglossal nerve. It's cranial nerve number 12. And all I'm going to have you do, Skylar, is stick your tongue straight out for me. You just want to observe the tongue and observe that it is midline. And that's pretty much the only way you can assess the hypoglossal nerve. I'm going to have you stand up for me. We're going to check some gross coordinated movements. And all I'm going to have you do is walk heel to toe. Take your time. Just take maybe 7 steps there. Perfect. And come on back for me. Okay, so she has nice coordinated movements. Her hands are down by her side as they should be. Can you stand on one foot for me? Very good. And put both feet together and bend your knees. All right, so balance is intact as well. So what we're going to do now is called the palmar drift. I'm going to have you put both feet together like they are. Put your arms straight out, palms up in the air. And just hold that for a second. Close your eyes for me. Okay, so that's what we call a negative palmar drift. If her arms started rotating inward, that would be a positive palmar drift. Now we're going to do what's called the Romberg test. You're going to put your hands flat at your side, feet together. Just look straight ahead and close your eyes for me. And I'm going to be right behind you. This is a test for balance. Occasionally, like I'm seeing now, you'll see a little bit of a sway. But that's still a negative test. Okay, so that's the Romberg test. Okay, we're going to do a couple different tests for coordination now. We're going to start with the finger to nose test. So I'm going to hold my finger here, and you're going to touch my finger and touch your nose. Touch my finger, touch your nose. Let's do that a couple times. Okay, good. Can we try that with your eyes closed? I'm not going to move my finger, okay? Okay. Why don't you open your eyes for me? All right. I'm going to have you now, I'm going to move my finger, and you're going to do the same thing, okay? Touch my finger, touch your nose. All right, very good. I'm waiting for her to miss. If somebody would, if a patient would miss your finger, that is called passing, and that's an abnormal finding. Another thing we want to do is have you touch all of your fingers to your thumb. Okay, very good. Put your hands on your knees and just go back and forth with your hands. Okay, excellent. Last thing I want you to do is slide your heel to one foot down the shin of your other and touch the ankle. Perfect. Okay, so coordination is very good. Okay, so we're going to test a little bit more with sensation. I have my paper clip again here, and we're going to check that sharp, dull sensation. So again, this is sharp, and this is dull, okay? So why don't you go ahead and close your eyes for me. Let's see your hand. Tell me what that is.
Sharp.
Okay.
Sharp.
Okay. Keep your eyes closed for me.
Dull. Sharp. Sharp.
Okay, very good. Okay, so her sharp and dull sensation appears to be intact. The last thing I want to do is test her vibrating sensation. Well, we will start at the feet. Can you feel that okay?
Yes.
Can. All right. And I'm going to do the same in her hands. And can you feel that vibration?
Yes.
Okay, a lot of times people with diabetes who have diabetic neuropathy can't always feel the vibrating sensation in their distal extremities. Sometimes you might have to move up the arm, sometimes even in the shoulder area to be able to feel vibration. All right, so we're going to do 2 more tests to kind of test the sensation aspect of the assessment. We're going to do what's called stregnosis, and basically what stregnosis is I'm going to place an object in, it's a common object, I'm going to place it in the patient's hand with her eyes closed, and she's going to identify what that object is. So if you could please close your eyes and open your hand for me. Okay, place that object in your hand and close it. And just kind of feel that for a second, and can you tell me what that object is?
It's a coin.
It's a coin? You know what type of coin that might be?
It's a quarter.
It's a quarter. All right. All right. So stregnosis is okay. We're going to do what's called graphesthesia now. And I'm going to have you close your eyes again for me and put your palm out flat. Just like that. That's perfect. Eyes are closed nice and tight. I'm going to draw a number, and you're going to tell me what number I drew. Okay?
0. 6.
6. Okay. All right. I'm a bad drawer, apparently. She got it right the second time. I did draw a 6. Graphesthesia is intact. Okay, so I'm going to do what's called the 2-point discrimination test. And it's the test for fine motor sensation. So Scott, I'm going to have you close your eyes for me. I'm going to have you hold out your hand just like you are. And I'm going to either poke you with one end of the paper clip or two ends. And I want you to tell me if you feel one or two, okay?
1. 1. 2.
Okay, perfect. Now what I'm going to do is I'm going to hold that, and I want to take my ruler here. That's about 4 centimeters wide, which is within the normal ranges that we want. You may also want to do this on the shoulder. The shoulder tends to be a little bit more of a less sensitive area, and you'll see that diameter get wider. So Skyla, let's do that again, okay? How many do you feel?
1. 1.
Yeah.
1. 1. 2.
Okay, perfect. And as you see, that got a little bit wider. And that's almost a centimeter to 2 centimeters. So this is definitely a less sensitive area. All right, so we're going to check her reflexes now. I want to start with the brachial reflex. Scott, if you could just kind of hang your arm over the bench there, that's perfect. Face your arm outward for me. Okay, I'm going to use the finer point of the hammer. Okay, as you can see, we get a little bit of a twitch of the hand here. Okay, all right. You'd also want to test the triceps reflex. Okay, not so much of a reaction there. I think that's more to do with my lack of practice with those reflexes. But that is the area that you would perform that in. You also want to test the brachioradialis along the radius here. A little bit of a twitch there as well. Then you move down to the patellar reflex. Okay, good. We got a nice patellar reflex there. And the last reflex you want to check is the Achilles tendon reflex. You should see a slight dorsiflexion of the foot. A little bit of a twitch there. I'd like to see a little bit more, but again, okay, all right. So those are the reflexes. Okay, so what I want to do now is check for the Babinski reflex. And what you do is you just take an object and you stroke along the outside of the patient's foot and you bring it towards the big toe. And I don't know if you could see this, her toes did curl a little bit, which is a normal finding. If her toes fanned out, that would be a positive of Babinski. Toes only fan in children under 2. After 2 years old, they should start curling and have a negative Babinski. If her reflexes were stronger than normal, say a +4 reflex, we'd want to check for what's called clonus. And what I do is I dorsiflex the foot several times, and the foot should return to its natural form very gradually. If the foot snaps back, we would say that that she has beats of clonus, and that's an irregular finding. This completes my head-to-toe assessment. I hope you guys enjoyed. Thank you. You want to move over to the left side. Now I'm feeling for the spleen. Holy crap, that was loud. I'm sorry. And the spleen is not. What was that? It like was gonna eat my hand.
I'm so hungry.
That was so loud. Oh man.